demonstrate you techniques of nasogastric tube insertion. These are techniques to gain access to the stomach and to get the specimen from the gastric content, to decompress the stomach and to get passage to the GI tract. It allows us to treat gastric immobility and bowel obstructions. The contraindications of nasogastric tube insertion is the basal skull fracture, where the cribriform plate displays, and there is a risk of the nasogastric tube insertion can go intracranially. One of the major complications of nasogastric tube insertion is vomiting and aspiration. Thus, we need to stand by the suction device during the procedures. So, once we have prepared, we need to prepare the equipment as follows. We need to prepare 2 different sizes of Rouse tube, 14 French, which is a 4.7 millimeter diameters, and 16 French, which is 5.3 millimeters. Then we have to prepare a 20 cc syringe for the catheter tips, irrigation syringe. The xylocaine 2% is for the analgesia. The emesis basin, another smaller basin with the 20 ml of water, and finally the stethoscopes. So after that, we will approach the patient and explain to the patient the indication of the procedures and get consent. We will position patient in a sitting position or head up in a 45-degree inclinations. We move on preparing ourselves. We wear glove, mask with the face shield and an apron. Then we move on to prepare the equipment. So I would like to choose the 14 French Rouse tubes. Okay, so this is the 20 ml of water. We will put here, fill the 20 ml of water in the basin. Okay, now after that, we will take the Rouse tubes. We will go to the patients, measured from the tip of the nose through the nose bridge to the edge of the ear loops, came down to the end of the sternum, midway between the navel and the end of the sternum. So the measurement will be approximately between 55 and 65 centimeters. So we use a marker to mark it. Next, we will check the nose to get the better size. So we see that on the left nostril, the lumen is bigger, and we can ask the patient to exhale onto the septum, to see which vapors is the bigger size. After we have chosen the left nostril, we will lubricate the Rouse tubes 2 to 4 inch. Okay. We will choose the biggest nostril and enter perpendicular until we meet the resistance, and inform the patient that these procedures could be uncomfortable, and we will spray the lignocaine 2% at the back of pharynx. So we have prepared a 20 cc water. We will encourage patient to swallow the sip of fluid into the mouth. So we will give some sips of fluid and instruct patient to swallow. So as the patient swallows, then we slowly insert the Rouse tubes into the nose back to the throat and slowly push gently down to the stomach. Until the marking of the level which we have measured earlier. Okay. Then we will test. We will get some air, put the stethoscope and inflate through the nasogastric tube and hear the bubbling sound. Okay. To confirm the placement of nasogastric tubes. Next, after it has been confirmed, drain the nasogastric content from the nasogastric tube and test with the pH paper, litmus paper, to confirm that it is acidic. Okay. Finally, we will secure the nasogastric tube at the side of the face. So we have completed insert the nasogastric tube in a conscious patient. Thank you for watching.